Good morning, everyone. My name is Mia, and I'm a student nurse in my second year at the University of Newcastle, and I work part-time in the hospital while I study. This is me here, and this is us. Today I'm here to speak about new antipsychotics that people with schizophrenia are being prescribed. This includes what they do, how they work, and what they look like in terms of recovery. But before that, I think it's important to discuss the diagnosis of schizophrenia, including some signs, symptoms, and its pathophysiology. Since the first documented case of schizophrenia in 1887, there has been huge social stigmatization and misunderstanding of the illness, based purely on society's lack of knowledge. Now, schizophrenia is incredibly complex, and we are still yet to learn everything about it, but this is what we do know. Now, we class schizophrenia as a syndrome, which means that it encompasses a whole range of disorders with similar symptoms and varying causes. It may be why many of you have had misdiagnoses or delayed diagnoses in the past. This can also be exacerbated by the many alternative presenting symptoms that affect the cognitive, behavioural, and emotional functioning of a person. These symptoms are separated into two main groups, positive and negative. Positive symptoms refer to certain experiences that tend to add to the complexity of schizophrenia and often occur episodically rather than constantly. Things like hallucinations, delusions, disorganized speech, and thought are most common to this category, however, remain distinctively alternative symptoms. People managing their schizophrenia may experience all or just a few of these symptoms, but some must be present in order to be diagnosed. In comparison, negative symptoms suggest a deficit in brain functioning, making activities of daily living increasingly more difficult and reducing a person's quality of life. Included in this is a flattening of mood, apathy, an inability to feel pleasure, a reduced interest in life, and social withdrawal. It is important to note that as discouraging these experiences are, these symptoms often arise as a meaningful response to difficult or traumatic life events. They do not occur spontaneously, and nor is a person mad for experiencing them. Now, researchers believe that a person's genetic makeup and external environmental pressures are key factors to the risk of developing schizophrenia. During childhood, an accumulation of multiple vulnerability factors can cause some fundamental issues in the brain associated with the development of schizophrenia in the future. This is evident in the neuronal breakdown of the brain in people living with schizophrenia. Neurons, the cells of the brain, are responsible for receiving and sending messages to and from the brain to the rest of the body. When they are disconnected, these signals are not being passed along properly. Think of it like whispers. I might whisper something to one person, and as my message travels along and reaches the last person, it might be the same or something completely different. The breakdown is concentrated in this portion of the brain here, called our pathways. Now, these two pathways control a person's emotions, behaviours, and social expectations with its conductor, dopamine. We often call dopamine the happy hormone because it helps us feel pleasure. In schizophrenia, as the communication between pathways breaks down, dopamine is not properly dispersed or regulated. One pathway becomes overrun by the happy hormone, making reality obscured. This is the cause of positive symptoms. The other pathway does not have enough happy hormones, making the person sad, being the cause of negative symptoms. To try to combat this dysregulation, in people managing schizophrenia, the healthcare team might prescribe second-generation antipsychotics. These medications work on the brain by attempting to help regulate dopamine levels. By reducing the excessive amount of happy hormones, antipsychotics decrease the prevalence of positive symptoms like hallucinations and delusions to a more comfortable level. It's much like when the next door neighbours have a loud party and you can't sleep. You might go over and ask them to turn the volume down a bit, and although it is still a little noisy, it's quiet enough to get to sleep. Most people recovering from schizophrenia will be given antipsychotics such as Abilify, Salian, and clozapine. These medications act in this same manner, turning the volume down on dopamine, reducing the noise. Unfortunately, newer generation antipsychotics have little to no effect on the negative symptoms associated with schizophrenia. Because there is already a deficit of dopamine in one pathway, if the medications acted here, it would make the negative symptoms even worse. Alternatively, first-generation antipsychotics do affect the associated negative symptoms of schizophrenia, however, are rarely used due to their detrimental and dangerous side effects. To help people manage and deal with the effects of schizophrenia, we as the healthcare team work in collaboration with you, your families, and carers to form strategies and plans in the prevention of relapse and in the reduction of symptoms. We can do this with a few recovery-oriented and evidence-based practices, including the use of medication. Second-generation antipsychotics are the latest, most advanced medications produced for people recovering from schizophrenia. Evidenced by consistent administration, most people have a significant reduction in positive symptoms and a reduction in relapse rates when taking antipsychotics. However, the medication does not cure schizophrenia. It blunts the effects of psychotic symptoms to give individuals the opportunity at leading an improved life and increasing their prospects at recovery. These medications bring with it their own challenges to be overcome. Now let's talk about what to expect when taking second-generation antipsychotics. In the first few weeks of beginning new antipsychotics, some common symptoms you may start to experience include headaches, nausea, and anxiety. These should settle down within the next month, but we can combat these with a few options. For instance, try finding and dedicating a quiet, safe space to be a calming zone. This might be your room, out in the garden, or a certain chair. We can train ourselves to know that when you feel anxious or have a headache, you have a place to retreat. In these first stages, it is important to start practicing communication methods with your nurses and your family. If you feel as though you need help, reach out as best as you can. The healthcare team are here to help, and we can intervene with whatever you need. If you are feeling sick, uncomfortable, or lonely, your nurses and psychologists are here to help. Now, before being discharged, we will practice self-medicating to ensure you are confident and reliable with taking your medications. Ultimately, it is your choice when to take it. It just needs to be taken in a consistent manner. For example, many people take theirs with breakfast or prior to a daily task, like their morning routine. The aim is to develop a routine, making it easier to incorporate and familiarize the medications into your normal life. It might be helpful to keep the pills and their information in one cool, dry place, such as on your bedside table. To remember to take them, you can make daily reminders on your phone, make an alarm, or write it on your calendar. We also have pill boxes that come in many different shapes, sizes, and organizational styles which help remind you to take your medication. In collaboration with your healthcare team, yourselves, and your family, we can assess the optimal plan for taking the pills at home. The goal is to fit the medication as seamlessly as possible into your life, rather than having to change it. Remember, it may take some persistence and cooperation to figure out what is best for you. Harm minimization strategies might be implemented in this period to create an agreement to adherence in the future. If you are struggling or would prefer not to take a pill every day, we can explore the option of taking depot medications. This means that we can give you an injection either weekly, bi-weekly, or monthly of an atypical antipsychotic. As you take the medication over a longer period, some alternative side effects may begin to set in. Unfortunately, these can be distressing in nature, associated with fatigue, dizziness, dry mouth, and drooling. Both male and female sexual functioning can also be affected. Disturbances in self-perception often occur, and health risks associated with poor self-care can arise. We can combat some of these with some tips and tricks. Sucking on ice cubes or sugar-free hard candies are a great way to prevent dry mouth, while using rubber pillowcases helps with nighttime drooling. Now, weight gain affects almost all individuals taking psychotropic medications, and it can have some major effects on the person's sense of self. Daily exercise and a healthy diet best combats weight gain, but it can be difficult to find motivation and keep this consistent. In instances where you may feel tired or too exhausted to move, the encouragement of others is incredibly beneficial. By supporting one another through recovery, motivating and hearing from those in similar experiences provide hope and reminds ourselves that recovery is not just possible, but inevitable. After discharge, you, with the support of your healthcare team, will decide the best management strategies to implement outside of the hospital. These are designed to improve your life and may encompass anything from cognitive behavioural therapies, interpersonal behavioural therapies to ECT. Routine follow-ups with your GP, psychologists and community healthcare team will be in place. And it is very important that in this time you continue taking your medications, even if you're feeling better. Through assertiveness training and the practice of role-playing, we can help to create effective communication tools between you, your family and healthcare team. This helps us understand if the medication is helping or isn't right for you. In every circumstance, you have the right to deny or accept treatment. It is in your hands. If you'd like more information, we have posters, information booklets and flyers to provide for yourselves and others. Thank you all for your time.